what President Obama himself said about single payer and how his position appears to have changed. This is what he said back in June of 2003, before he was elected even to the U.S. Senate.
I happen to be a proponent of a single payer universal health care plan. The United States of America, the wealthiest country in the history of the world, spending 14% of its gross national product on health care, cannot provide basic health insurance to everybody. And that's what Jim's talking about when he says everybody in, nobody out. A single payer health care plan, universal health care plan.
That was State Senator Obama. This is Senator Obama. He's speaking more recently when he was on the presidential campaign trail.
On what you were just addressing,
right.
And why not single payer? Why not get the corporates battling and the lobbyists out of the way and just go to a single payer?
Well, I've said this before. If I were designing a system from scratch, then I'd probably set up a single-payer system. For those of you who aren't familiar with the terminology, single-payer basically means that you've got one government-funded program. It doesn't have to be government-run, but it's government-funded. Everybody, Medicare would be an example of a single-payer system if everybody was in Medicare. But the problem is we're not starting from scratch. We've got a system in which most people have become accustomed to getting their health insurance through their employer. And for us to sort of immediately transition from that, and given that a lot of people work for insurance companies, a lot of people work for HMOs, you've got a whole system of institutions that have been set up. Making that transition in a rapid way, I think, would be very difficult. And people don't have time to wait. They need relief now. So my attitude is, let's build off the system that we've got. Let's make it more efficient. We may be, over time, as we make the system more efficient and everybody's covered, decide that there are other ways for us to provide care more effectively.
That's Senator Obama on the presidential campaign trail. Dr. Quentin Young, what's wrong with that?
Well, it's one of the few times when Barack has been dishonest. He knows, and all America knows, that our experience with employment-based insurance and these other Mickey Mouse things have been increasingly a total disaster. You have a $2.5 trillion industry with vested interests, the private hospitals that for profit, the HMOs, the health insurance industry, making billions upon billions, and things getting worse. He knows and should act on the fact that time is running out. The American people are hurting. Over 1 million Americans go bankrupt due to medical bills each year, and there's a new study, incidentally, that will show that 50% of bankruptcies are due to health costs. It will be 60%. So we have a worsening situation, and a man who wants to lead a country which is in great peril had best do some courageous things. I really feel that we have to mount national concern about this.